Hi there, I'm Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. And Julie, everywhere I turn, somebody is posting their Moderna or their Pfizer card. Who is eligible in this community for the vaccine currently?
Well, as of today, everyone that has been eligible, so anyone 16 and up with any underlying health condition, they're still eligible. All the previous jobs that we've mentioned are still eligible. But as of today, we've also added food and beverage workers, so anyone working in restaurants or food service, construction trade workers, religious leaders, higher education staff, government workers, and the media.
So prior to this, I signed up. No one, when I got there, asked to see any ID or why I'm there or am I eligible. Is this pretty much been on the honor system up to this point?
Yeah, it has been, and it will continue to be that way. What we were most concerned about is getting people that were most at risk in. So we made all kinds of, you may remember at the beginning, everything targeted towards seniors was just seniors, so that we made sure that we got them in and people weren't jumping ahead in line. But yeah, it is essentially on the honor system. We want to get as many people vaccinated as possible with as few barriers as possible.
And I saw you personally were telling people, email me if you're a senior or call the public health district and we will get you there. Did you have a good response to that?
We did, actually. We did about 150 vaccines on that one day that we had the clinic scheduled. So it's still the same thing. If you are someone who is 65 and older, you can, and you haven't had the vaccine yet, you can email me at jpryde, Pryde, at c-uphd.org, or you can call me at 217-531-5369. I usually answer, but if it's in an evening or some other time, just leave a message and I will get back with you.
Let's talk about the fact that Pfizer and Moderna, as I mentioned earlier, seem to be the two that people talk about, comparing reactions and things like that. Johnson & Johnson, I don't hear much about that. Has it reached our community?
It has. So Walgreens did a large 1,200 dose clinic a few weeks ago at Douglas Center, and now this week Carl is going to have it as well. I've also heard that is in Danville, and we have been told that starting probably, let's see, what is today, the 29th, starting around April 5th, we should be getting some more of that as well.
I want my child to go back to school, as we all do, but I want it to happen safely. We just filled out a survey saying we'd like our child to go in person in the fall, 5 days a week. If we mask them up and if we social distance them, they won't be vaccinated yet. Is that going to be safe? Did we make the right call for that?
Yeah, I mean, as long as people are masking, distancing, that's just as safe. The reason why it'll be a lot safer to go back to school is that the teachers and all the adult school staff should be vaccinated, and parents and grandparents should be vaccinated by then. Can the kids still transmit it among each other? Yes, but that hasn't really been so much of a concern because of the masking and distancing. Where they seem to be getting the outbreaks are where if they're involved in sports, if they're involved in activities before or after school where they are hanging out with friends and things like that. So, certainly kids are not going to be protected, but in the overall risk categories, they are much, much lower. That said, there are kids who may have serious underlying health conditions, and parents may want to consider the remote only option if that's the case until the vaccine is available to their children.
While we're on the subject, there are trials happening right now, 6 months up to 11. We're looking at 12 and up getting the vaccine, hopefully by the fall. Do you have any update or concrete stats of where we are with some of these trials?
I don't. I know that there are a lot of people that are looking into the trials. And of course, if you have your child signed up for one of the trials, they have basically a 50-50 chance if they get into the trial of getting an actual vaccine versus placebo. And you won't know, of course, which it is until the end of the study. But I know that the studies are ongoing, and as soon as they get the data back from that and show that it's safe and effective, then they'll be able to hopefully get the emergency use authorization and we can start vaccinating kids. Really don't look for it to happen before fall, however.
There are so many people that are still reluctant to get the vaccine. Anecdotally, wouldn't you say the people you talk to, we really want our kids to get the vaccine. We want life to be normal for them. Would you say there's a little bit, just like I said, anecdotally, it's a little bit different of a mindset for adults wanting to vaccinate their kids and less reluctance?
We haven't heard much about that in general, and I think probably it's because they're not eligible yet, and the vaccine is, the vaccine isn't even approved for them yet. But in our county, we're really seeing a high uptake of vaccine, which is great because, of course, those are the protective factors for not only individuals but also the community's health and protecting our hospital system. But my thing is, if anyone has a vaccine hesitancy at all, talk to your healthcare provider. Don't Google something, talk to your healthcare provider about it, about your specific situation.
And don't look up on WebMD because we're not amateur doctors. The variant is now prevalent in, they say, all 50 states. In England, we have friends who said the only things open right now are drugstores and grocery stores. Nothing else is open. Is that potentially something that could happen here in the US, or at least Illinois, what you and I are focused on?
Well, certainly it can happen in the US, and there are already places that are just being ridiculous about acting like COVID's not here. And they are absolutely going to see a spike in cases, hospitalizations, and death. Illinois, the good thing about Illinois is that the IDPH and the governor's office are keeping really close tabs on the hospitalizations, the cases, deaths, things like that, to make sure that if we start going in the wrong direction and can't pull it back, that we're able to put in mitigation strategies to help with that. Champaign County, I think we're doing such a great job, and I really hope that we get enough people vaccinated in our whole entire region that we don't have to worry about that. But it's hard to say. I mean, we'll have to do what we have to do, but I think that we're doing a good job keeping numbers down. The outbreaks that we're seeing right now are associated with unvaccinated people doing things. So that would be, unvaccinated people traveling, kids in sports. We're having a lot of outbreaks with kids in sports, and then people having family gatherings with people who are not vaccinated.
We're going to get to family gatherings in a second, but while you mentioned numbers, could you give us a little bit of a snapshot of where we are in our county?
Sure. So right now we have 306 active cases. They are in isolation, 414 in quarantine, 9 are hospitalized right now from Champaign County, and we have had 137 deaths. Our positivity rate in our county right now is at 3%. That's obviously been going up. And we've had a total of 18,915 total cases of COVID since the start of this. Our vaccine numbers are, and this is exciting, we have had 113,735 vaccinated as of yesterday. 48,553 of people who are 16 and plus are vaccinated. That's 28.10% of our county, and 76.41 of people 65 and older have been vaccinated. And again, those are the ones most likely to have serious complications, hospitalizations, or death.
Those are amazing numbers. And it's incredible that so many adults are double vaccinated. You can breathe a sigh of relief. However, heading into this coming weekend, people want to congregate for Easter. Let's say that all the adults who have been vaccinated get together, but obviously none of the kids have. What is safe and not safe to do this weekend?
Well, if you're vaccinated, you can get together with other vaccinated adults inside without masks. So that's good. The kids are not vaccinated, but they can still be there together in the house if it's a couple of household groups together, and they of course they can still do things outside as well. If there's anyone that is at risk, it's a child or that's unvaccinated, you need to take special precautions around that. But you know, that's the point of vaccination, is so we can get vaccinated and get together. So those who have been already vaccinated will be getting together.
The previous head of the task force told us that the pandemic would be over by last Easter, and it's not over. And by this Easter, you know who I'm talking about. We are anxious, we are exhausted, we are tired of being cooped up with the pandemic. Can you give us a little bit of a pep talk, because the finish line is now visible? Can you kind of just remind us of that?
I will. So first of all, it is important to know that it is depression and anxiety are a normal part of going through something like a pandemic. You know, it is a marathon. It is not a sprint, as we've found out. We are getting much better. Things are looking up. Cases are down, you know, everywhere. We cannot worry about every single state around us that just seems to be doing things the wrong way, which is frustrating and sad, because people will needlessly die from this. But, you know, try to focus smaller in on our county, for example, and what a good job people are doing of getting vaccinated. We still have demand way outpacing supply. So we know that within the next couple of weeks, the vaccine supply will increase. So that is good. So we're not worried about people not wanting to take the vaccine here. We just don't have enough yet. Other counties and other places are already seeing people slowing down on that. So I'm going to give you some guidance that the CDC suggests to do to kind of take a break and get through this remaining part of the pandemic. But number one, I have to say, people need to understand that their feelings are normal. It's not unusual to be depressed or anxious during something like the pandemic and all of the things that come around it, the financial issues, every other situation, the grief. But we are on the other side of this, and we are moving towards getting out of it. So some suggestions from the CDC: take a break from watching, reading, or listening to news stories. Just take a break from that for a while. You're not going to miss anything that you won't be able to catch up on soon. Take care of your body, take deep breaths, stretch, meditate, try to eat healthy, well-balanced meals, which I need to start doing again. Exercise regularly, which I need to start doing again. Get plenty of sleep. Avoid excessive alcohol, tobacco, or substance use. Continue routine preventive measures, and get vaccinated as soon as you can. That does have makes you sort of relieved and makes you feel like you really are getting on the other side of this. Take time to unwind, connect with others, and especially now that the weather is getting nice again, you know, get outside with friends and go for walks, and then connect with your community or faith-based organizations. If you or someone you know, however, has serious issues related to depression or anxiety or other problems related to COVID or anything else, I've given Jason some numbers to put up on the screen, but locally we have a crisis line, which is 217-359-4141. That's a 24-hour suicide prevention and crisis hotline here in Champaign County. And then there's also the SAS, their number, that's for children and adolescents in crisis. That's 1-800-345-9049. So
there is help out there in many ways.
There's help out there, and you know, we want people to stay healthy and make it through this. So if you know anyone who needs help, you know, help them out. And if you know anyone who needs a vaccine, help them get the vaccine if you've already gotten yours.
I always have so many more questions, but we're going to save them because that is a good thing to end it on. We'll have Jason put the graphics up if anyone needs help. We are all in this, and nobody should go alone with anxiety and depression and without having somebody to reach out to. We all reach out to you, Julie Pryde. So one day we're going to be able to repay the favor. Jason Liggett, thank you so much from the City of Urbana and UPTV. Of course, Diane Marlin, Mayor of Urbana, thank you again. We're very lucky that she just recently won her second term. Julie Pryde, please thank your staff. Champaign-Urbana Public Health District, thank you so much for your time.